Hey, 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 happy Friday, everyone. I'm Blake Hotchkiss, Clinical Education Specialist at the Association for Vascular Access, and joined with me today, our Director of Clinical Education, Judy Thompson. Hey, Judy, it's been a while.
Hey,
Welcome.
Blake. Thanks. It's been a little bit.
Yeah, so today, and I'm sure you guys have seen this on our social media platforms, the e-blast that we're sending out to members or people on our mailing list. AVA is launching a qualitative research study trying to understand healthcare equality when it pertains to vascular access. And so to launch this, the launch of the survey, we're doing a lot of information out there. We sending out videos of different clinicians that are on the research team, talking about the importance of understanding healthcare equality and again these implications in vascular access. And so part of that is getting some people on Facebook Live. And today, Judy. So tell us a little bit about our team and this research study.
Wow, we've been working on this now for, oh gosh, 8 months. And I'm so excited about this team. So we are 11 strong researchers, and the team comprises of folks from ANA, ECRI, INS, Marion University. Oh gosh, I'm forgetting a couple. Help me, help me, help me. But the team is
A-
strong.
yeah, like
So we
APIC
have
and
clinicians,
yeah, there's tons of
APEC,
people
right.
on this board. So lots of perspectives.
A patient. We have
Mhm.
Swapna Kakani is representing patients with us. So it's a strong team. We're very, very opinionated. It's been a very fun and challenging to get these questions together to hone them just right. And I know, Blake, you did a lit review, you went and did a deep dive to try to find if somebody else has done this, and nobody's done it yet. So there's
Correct.
questions that we think we know the answer to. Intuitively, we think we do, but we don't have data to support it. So without data, we can't make true change. As our friend Mickey Haas says, in God we trust, all others bring data. Well, that's what we're trying to do. The survey, the our number one thesis or our number one answer we want to or question we want to answer is, do people of darker skin tones have a different experience with vascular access than people of lighter skin tones? And many of us in vascular access have worked with patients of darker skin tones, and we know sometimes, especially without any of our technology friends, ultrasound or near infrared, it's hard to find veins sometimes. And we believe we know that's true, but is it true? So that is one of our, or the biggest question we want to answer. And along with that, we have some other factors we're looking at, whether it be chronic conditions, age, body habitus, geography. So there's a lot of things we're looking at. I'm excited about it because I really cannot wait to find out what kind of answers we get out of this. Now, Blake, I know you're part of our research team,
Hmm.
and we've been having fun with this for a little bit.
Well,
What are
I
your
think,
thoughts on it?
yeah. So, from my point, looking at the evidence that exists, is I don't, really, there isn't a lot of evidence that looks directly at the question: does skin tone impact vascular access outcomes? And what I love about this research is that we're asking, and it's a qualitative study, so we're gleaning information from people's perspectives, and
Right.
we're looking at it from two different lenses in this equation. One is the patient, which we've launched that survey. It's available today to take. It's a short survey, but we want to know, and we're looking at a spectrum of skin tone, because we know that there's polar ends of skin tone and there's everything in between. And how does that really impact this? And in research currently, um, there are some interesting outcomes that have happened historically. A lot of the studies that I've seen circle around dialysis, and we want to look specifically about IV therapy. So that's a great perspective to have. I mean, Ava's a vascular access specialist community, and we're trying to understand the problem from both the patient side And then also from the clinician side. So do you, as a practicing clinician, have issues sticking people who have those darker skin tones on the spectrum? And I think, like you were talking about, we have some very clear perspectives, what we think is right,
Sure.
but we really need to understand what the actual experience of people is. And that's why it's so important for us to do this qualitative study. So we need to understand the perspective from clinicians and patients, because how do we drive
Yeah.
change at the practice level if we're not asking the question, really getting to the root of the problem and understanding the gaps that exist? So I'm honored to be a part of it, and proud to be working with so many people who are so passionate about this subject matter, and also, their interest in making a difference in how we improve the care that we provide to patients.
I agree. I feel the same. And knowing that we're looking at both sides of the spectrum, we're looking at the patient, then, and we're looking at the clinicians. I, I hope comparatively we can come up with some good analysis that takes us down a path that we can make meaningful change. And it may just be something we spin off and we have to do more studies on, but we have to jump off the diving board at some point. So we did it.
It has to
I
start
hope
somewhere.
it does. It does. And even though the patient survey is open right now, and many of us are clinicians, we're also patients. So don't feel that just because you're a clinician, you can't answer the patient survey, because you can. If you've ever had an IV and you live in the US or Canada, please take the patient survey and then come with a different mindset as a clinician when you take the clinician survey down the road. But we'd love to get your responses. It is anonymous. We can't find out who you are. So please come in, be brutally honest, and
Okay.
help us make change.
This is, like I said, it has to start somewhere, and I think that too from the researchers on this team is like all these uh, big ideas and concepts and how this shapes practice, and how do we get this study out the gate so we can understand the problem. And there's a lot we're asking, but it's still so small compared to all the problems that we know exist in healthcare today. So um, very important perspective and study to really understand problems and where the gaps are and how do we make meaningful change.
We
Well,
need five
gee,
to 10 minutes of your time, guys.
yeah.
That's it. 5 to 10 minutes, please.
Yeah. If you are interested in taking the survey, and again, not just you having an IV, and I think this is one thing that's really hard to articulate in and keep these messages short. When we're crafting social media outlets, certainly we're developing a landing page that's going to help kind of help people understand what we're asking better. The survey isn't just about adults and vascular access, it's about people across the age spectrum. So if you have a loved one who may not be able to take the survey that you want to answer for them, I believe we have openings for that too. More specifically, our vulnerable populations. So, like our small children, pediatrics, those people, we want to know your experience. So caregivers for people or guardians can also participate. So it's not just an adult study. This is across the age spectrum.
True.
There's a lot of different people that we want to understand that this perspective from. So take the
Absolutely.
time. Again, it's a short survey, but if you qualify or you're interested in taking the survey, and we hope you are, please check out the link in the description. So that will take you right to the survey. I can't thank you enough if you've seen our posts and you've shared them. I will tell you,
Yeah.
liking it or giving a thumbs up is great, and we appreciate the love and support when we do social media. But if you want to really get this word out there, what I challenge you to do is take a minute and repost this, put a little blurb on this, say, this is so important to understand, and I'm sharing this because I am passionate about making change. So share, repost, depending on what platform you're on, but make sure that you're spreading the word, and that's how you do it. And we are really looking. We've got a lot of responses already from what we've done so far this week, and we're looking for we're really hoping to get a good sample size. So again,
We
we're well
are.
on our way and we're really excited about it. And Judy, how long is the survey open for?
It's open for 60 days. So August 26th, the patient survey closes. And then the clinician survey won't launch for probably 2 more weeks, and that will be open 60 days. We will be giving the preliminary results at AVA during a general session, and then the whole team will come together and write a publication. The other thing that just coming off of what Blake just said, if you're interested in getting this out even at a larger scale, maybe at your hospital, through your church, just email me or avaed@avainfo.org, and I'll shoot you over a PDF with a QR code and the link. But anything you can do to help us would be greatly appreciated.
Fantastic.
What do you think,
Well,
Blake?
I think that's awesome. So again, we need your support. And again, sharing, reposting, reach out to us so that we can, we have a really wonderful flyer handout that you can print out with the QR code. And if you need something in hand to be able to share that as well. So, the boots on the ground stuff, or sharing it on your socials, or getting it out there through your other organizations, or again, patients, loved ones, we want to know. So
We're all patients.
with that, I'll take us out from there.
Thanks, Blake. Bye,
Well,
everybody.
guys,
Thank you.
thank you so much for tuning in for Facebook Live. You can follow the Association for Vascular Access anywhere out there on social media. That's Facebook, Instagram, LinkedIn, Twitter. Of course, if you're a big fan of YouTube like I am, you can check us out there as well. And with that, we'll catch you on the next one. Bye, guys.
Bye, guys.